I'm Charles Bankhead of MedPage Today. A breast cancer vaccine directed against HER2/neu substantially reduced the risk of recurrence and mortality regardless of a patient's level of HER2 expression, according to a presentation at the American Association for Cancer Research. Dr. Linda Benavides of Brooke Army Medical Center in San Antonio discussed the findings at an AACR press conference.
There's been a tremendous amount of excitement in regards to HER2/neu directed therapy in the past couple of years, and the research that I'm presenting at this conference is another important milestone in this area, in the targeted immunotherapy area. Historically, we have focused primarily on patients who are HER2/neu overexpressors because they are candidates for trastuzumab, also known as Herceptin. These HER2/neu overexpressing women qualify for trastuzumab, and they're only approximately 25% of all breast cancer patients. And the data that we're presenting at this conference shows something very surprising to us. The fact that our HER2/neu directed E75 peptide vaccine has shown results in patients with all levels of HER2/neu expression, but the best effect has been in the HER2/neu low expression patients, which is approximately 50% of all breast cancer patients. And most importantly, this 50% of all breast cancer patients have been a group of women for whom no immunotherapy treatment is currently available. The recurrence rate in both control groups, over and low expressors, was 18.2%, and the recurrence rates were decreased to 10.7% in the low expressing women and 13.8% in the over expressing women. But most importantly, the mortality rates were decreased in both these HER2 low and over expressing women. The mortality rate for the overexpressing patients was 9.1% in the control group compared to 3.4% in the vaccine group. And the mortality rate in the low expressing patients was 6.8% in the control group and 0% in the vaccine group. So additionally, there appeared to be a vaccine effect even among patients who did recur. For the overexpressors, the risk of mortality in the control group among those who recurred was 50%. Compared to 25% in the vaccinated group. And for the low expressors, the risk of mortality in the control group among those patients who recurred was 38% compared to 0% in the vaccinated patients. So in summary, the subset analysis that I'm presenting shows that the patients expressing all levels of HER2 benefit from the E75 vaccine, but that the low expressing patients drive the greatest clinical benefit with a larger decrease in recurrence and mortality. These findings introduce the possibility of HER2/neu-directed immunotherapy for the majority of breast cancer patients. And I cannot stress enough that while these results are exciting, the data needs to be reproduced and proven in phase 3 testing.
I'm Charles Bankhead, MedPage Today.